Got some things together here. So tonight we're going to talk about HCPCS coding. We're going to talk about the different kind of procedure code coding, and then we're going to go into HCPCS coding. So I'm going to erase this. Different types of procedure code coding. Procedure code coding. Okay, so I have said one time before that procedure coding does what? Procedure coding tells what? Huh? Huh? Yeah, the procedure, what was done, but in plain English, it tells what? What's being done. Something I said all the time, Ashley. Okay, I'll help y'all out. Tells what the doctor did. Tells what it's very good answers what you said, Yesenia, and what you said, Brenda. Very good answers. But it tells what the doctor did, or better yet, what the provider did. Now, a provider can be not only a doctor, it could be a nurse practitioner, it could be a physician assistant, it could be a doctor in physical therapy, it could be a speech pathologist, it could be an occupational pathologist, occupational specialist, you know what I'm trying to say. My tongue is getting twisted. Okay, so procedure coding tells what the doctor did. I'm going to move this up a bit so I don't trip over it. Okay, super fantastic. Super fantastic. Okay. Now, it could be either one of those three. Okay? Now, you have different books. You have the ICD-10 PCS book. Okay? You have the CPT book. And you also have the HCPCS book. Okay? The ICD-10 PCS book is mostly used for inpatient procedure coding. Okay? And these are these folks that have these credentials that work on stuff like that. Okay, they have those credentials. Okay, CPT, which are your credentials. Okay, these are typically seen in doctor's offices for billing and outpatient facilities. Sometimes you can have patients coming in to have chemotherapy or sometimes physical therapy at a hospital, but they having it done on an outpatient basis at that hospital. Okay, so they're not necessarily inpatient. So make sure that you pay attention to the dates of services and things of that nature. Okay? Now, HCPCS code, same thing. Seen in doctor's offices, outpatient facilities, and also inpatient facilities, because sometimes you have some patients who will go home in a wheelchair, or go home with crutches, or go home with a Hoyer lift, maybe some sort of CPAP machine or respiratory machine, or colostomy type things to help them if they had bowel obstruction of some sort. Okay, so these are the 3 books for procedure coding. So let me ask the question again. Taylor, what is procedure coding? What does it do? And which providers are what? Therapist, occupational therapist. Very good. Very good. Brenda, will you ever use an ICD-10 PCS book in a physician office building? No. Very good. And she can testify to that because she works at an actual doctor's office. Okay. All right. Ashley, what does CPT mean? Bless your heart. Caught you off guard. Yeah. Yes. Okay. Yesenia, what does CPT mean? You don't know either? What is it? Who said it? Somebody said it. Okay. Current procedural terminology. Current procedural terminology. Okay? Current procedural terminology. Okay? HCPCS. Somebody look on the label of their book and tell me, what does HCPCS mean? You want to try to Google it? Healthcare Common Procedure Coding System. Very good. Very good. Very good. Now, what the HCPCS, what we're getting ready to do with this assignment, what the HCPCS do is, hi.
You're in the middle of lecture. Can I borrow you for just 2 minutes or 3 minutes?
Sure. Let me turn off my thingy. Give me just a few minutes. Hold on. Let's turn that off.
Is the room too warm?